Good morning, Linda. This is Craig Christensen with H4 Technology. Wanted to give you a video overview of our Compass Data Management Analytics solution. From the home screen, I click Dashboards. Predominantly when we're working with healthcare systems, we are doing the data aggregation and data standardization into our data warehouse. And then we provide this visualization tool for their core key metrics that they're monitoring, whether that's by hospital overview or whether it's by department. So these are some samples we've built, and we also have the ability, generally when each client has their own unique need. An example of that is a surgical hospital wanted to compare utilization of room rates by service, by doctor, and they also wanted to compare like late starts, so appointment times compared to actual in-room times from when they start the surgery. These are all things we can build and easily build with once we have the data aggregated into a common platform. So this example here is the hospital admissions. As you can see, we can do different groupings. This could be different departments, different clinics, different, the hospital versus a clinical setting or long-term care. I can hover over the months to see the data elements, and I could click on a hospital grouping and the chart changes. So it's very interactive, very customizable to the user. There's standard 30, 60, 90-day thresholds, but most people are using this calendar view where they can slice and dice the data sets to see the month, the year, maybe it's last quarter, maybe it's Q3 of 2016 that they want to compare. You can easily go in and select a date and date range. We have filters available to all our graphs and charts, so we have the ability to, this is a readmit comparison, length of stay. I could change that to age to see the age groupings. This readmission rate one has diagnosis codes, so you can hover over that, and then I can also go down to the provider level detail. The CMS compliance tab shows readmissions by medical conditions. So these are COPD, heart failure, the core CMS measures. We have red and green here to easily show, okay, red's bad, green's good. I can once again click on a different grouping. The charts will change, show the interactive modeling of that. If I wanted to, here are my, since I clicked on Innova here, my patient records below changed, so I can dive into that data. So an example is this COPD. That's the red area. I'd want to know who these patients are and what's going on with them, and provide that to maybe a care manager for preventative treatment. We have a variety of other tabs up here. This risk management one, I'll show you, has a variety of options. This is a predictive modeling for readmission measures. So it's length of stay, acuity, comorbidity, and ER visits. And I just wanted to show, once we have the data in, we can expand on that once we get down to the data set and show more details if we have those records. Another neat function within this BI tool is this whole self-service concept. So this is providing tools to the end users to create their own analysis, create their own dashboards and reports through the tool. I can create my own folder structures over here, and then these are the analysis I've created. All these can either a dashboard or report can easily be shared with another user. I just have to click the share button. Here's my user list. I click on Chris and I close it, and it's shared with him. You can see that it's changed color now. I can delete that if that's not an analysis I want to use. All the reports can be scheduled, so through the system I can create this from and to, and create a subject line. I can schedule this out to run daily, weekly, at a certain time. I can end it, have an end date. If I want to run it for a month, I can do weekly, pick it on every Friday. I want the sum of the week, or whatever your fiscal week is. So that just provides a lot of flexibility with people not having to go in and run reports, just getting them pushed out to them. From the analysis, to create a new one, I just click Create Analysis, and then I select my data elements, and then I have the ability to choose down to the field level what I want to include in that analysis. I can select multiple data sets, so once we run it through the production system, I have blue data set, red data set, and down here in my data table you can see the different red and blue data sets. I can add formulas to these tables. You can create new columns if I need to calculate whether it's a variance in time, whether it's an actual financial calculation with cost data, or the like. We also have filters, so if I wanted to include date ranges, compare if it's in the list on a certain provider or a certain procedure code, I can easily filter down to those type of values, or do a range where if it was like cost data, you could compare over a certain average. So we also have the ability to add charts to that data sets. This allows you to really create the visualizations on your own. So there's bar charts, line charts, pie charts, all these type of things can be created, resized, and used in my dashboards or reports. On the table itself, you can export the table. So once you get it filtered down, if you need to export it in Excel, CSV, PDF, I can also do filtering and aggregation on the table itself here. So if I wanted to count, distinct count, format data, those type of things, I can always move my columns if I wanted to move these around, so it's easier for me to manage this data and look at it during my analysis. I also have the ability to save these. So if this is a table I use quite frequently, I can go ahead and save this table, Craig's data table, so I don't have to come in here and recreate my filtering and sorting, and I can just pull it up to reuse. Same with the visual, the pie charts and graphs. So once we have our analysis saved, just for demo purposes here, I can go home and my analysis will show up here. I can author a dashboard out of that analysis. I can create a report. So dashboards, we create a dashboard. It's going to bring me back to my visual gallery, which are all the items I've saved that I want to review. So a simple click of the button, I can add those to the charts and go from there. So let's just do this and this for an example. Click done. These charts will show up right here. I can change the layout, 2-panel, 3-panel, free form, however many charts I want on a dashboard. I also have the ability to add multiple tabs. So I've seen this used where I want to maybe have the same data but apply different filters to it, whether that's a date range, time range, cost range, or value. So I can easily click through and compare. The report, once we can authorize reports, you can just click this author report button over on the left. We have a design and a graphical view. So the design view allows me to really create the report I want from the data I have. I can add new visuals. I can add new tables, new graphs, new charts, kind of, whatever I wanted onto this report. I can add images, whether that's logos or PDF links here, by simply dragging and dropping. Text is always, a header, footer, those type of things you can easily add. And split rows, just creating a split row, so we have 2 fields, and then I can, if I needed to resize something, I could easily resize those within the reporting mechanism. The view is actually viewing the report. I think this one has a variety of different graphs on it, probably similar, and the like. And from there, we have printability and those type of things to easily print or download the reports up in the upper left-hand corner. So that's a high-level overview of our system. I appreciate the time and you having some interest in what we're doing. And I'd love to, if you have any further questions or anything, we can always get back on the phone or conference call and review this with you. So we appreciate Leroy's help and connecting us with you, and look forward to talking to you in the near future. Thanks very much, and have a great day.